Hello everyone, welcome to Colonia High School. I'd like to welcome our experts from the state agencies. From the Department of Health, we have Commissioner Persicelli and Dr. McGreevy. From the Department of Environmental Protection, we have Commissioner LaTourette. Without further ado, I'd like to introduce our Mayor, John McCormick.
Thank you, Dr. Massimino, and thank you for your leadership during this situation. You have kept the parents of your students and your employees informed of all facts related to this issue, and they were aware of your plans and your progress, and we really appreciate working with you and the Woodbridge Board of Education. Sometime around the end of March, the township learned of various social media posts related to several incidents of brain tumors and brain cancer among students and faculty of Colonia High School from approximately the period of 1975 to 1999. We contacted the author of the posts, former student and former resident Al Lupiano, and offered to help. We immediately contacted our environmental engineers, T&M Associates, a well-known engineering and consulting company with a long history of working with our township, to consult with them about how we could utilize township resources to help the school district evaluate this situation. We recognized that the township was uniquely suited to assist because of our relationship with T&M and because we have our own health department team of experts that is used to assisting our school district with various issues, including the COVID-19 pandemic. T&M engaged the services of a subcontractor, Cabrera Services, Inc., a nationally recognized radiological and environmental remediation company, and recommended a course of action to test the air and grounds of Colonia High School, recognizing that radiation is widely known as a primary source of brain tumors and cancers. We then consulted with both our state government through the office of New Jersey Governor Phil Murphy and federal government through the office of our Congressman Frank Pallone, who luckily is the chairman of the Energy and Commerce Committee in the United States House of Representatives, which covers environmental issues like the one we are dealing with in Woodbridge Township. We discussed our plans with them in a 90-minute conference call organized and run by Congressman Pallone on April 4th, which also included the New Jersey Department of Health and the Department of Environmental Protection and the federal offices of the Environmental Protection Agency, the Center for Disease Controls, and the Agency for Toxic Substance Disease Registry. All parties to the call understood and agreed with the township's plan. We fortunately had a council meeting the next night on April 5th, where we passed an emergency authorization which allowed us to appropriate $450,000 in township funds to investigate the situation with the unanimous support of our township council. This allowed us to spend the money currently in the fiscal 22 budget and raise the funds in the following fiscal 2023 budget. Although we appropriated the funds, we fully expect to be reimbursed for any expenditures through state and federal entities, and we have made that clear to all parties involved, and we have received assurances that they would work with us to accomplish this goal. Though this is a school district issue and not directly a township issue, we decided to get involved partly because of our terrific relationship with the Board of Education, but also mostly because we could act much quicker and more decisively than either the state or federal governments. This matter was too important to wait for government bureaucracies to act. At the same April 5th meeting, we authorized T&M to commence their work with Cabrera through a $221,350 contract, and they began work 4 days later on Saturday, April 9th. That day, Cabrera placed radon canisters throughout Colonia High School, which stayed in place until they were collected on April 25th and sent to a laboratory for analysis, and those results will be discussed here today. Cabrera also started a complete study of the entire buildings and grounds of Colonia High School with gamma radiation scanning devices on April 9th, which took place that weekend and the next 3 weekends through April 30th. The outside athletic fields were closed down only for the weekend of April 9th and 10th to minimize interaction between the testers and the students, and interior testing was only conducted when there were no students in the building. Those test results were also received recently and discussed with various state and federal agencies and will also be discussed here today. We also looked into various theories that contaminated fill was brought to the site from a landfill 12 miles away when the school was constructed back in 1967 but found no evidence to support this theory. The school was built on forested land with no prior use, and construction experts agree that based on the topography of the site, it was very likely that dirt was moved around to level the building, but that no material needed to be imported during that process. Today, we are very happy to announce that our extensive testing for both radon and radiation in the interior and exterior of the school building produced no evidence of any cancer-causing hazards that warrant further investigation. This is terrific news for the current students of Colonia High School and their parents who are worried about their safety, along with current staff members, and it is also great news for all former students who attended and staff who worked at Colonia High School since it opened back in 1968. We sympathize with anyone who has experienced brain tumors and brain cancers, especially those who lost loved ones to this terrible disease. But there is no cause and effect relationship between those illnesses and the building or grounds at Colonia High School. The Environmental Protection Agency and Center for Disease Controls have reviewed the findings from Cabrera and agree with our conclusion. And the New Jersey Department of Environmental Protection has taken a very active role in the process and has performed a detailed evaluation of the study and also concurs with our conclusion that no further testing is necessary. The DEP also issued a valuable report indicating that there are no overall elevated levels of radiation in our immediate area above normal base levels, which further supports our position that no further action is necessary. Copies of all documents referred to in this presentation will be distributed to all members of the media immediately after this press conference, and they will also all be posted on our webpage along with the video of today's press conference. At this point, I would like to turn the microphone over to the Commissioner of the New Jersey State Department of Environmental Protection, Mr. Sean LaTourette.
Thank you for that, Mayor, for the introduction and the invitation once again to be in your community. You know that I grew up in Woodbridge, and I see this community as my home. So I have the privilege of leading New Jersey's Department of Environmental Protection, which does a lot of different things, right? We examine environmental releases of toxic substances. We ensure the protection of waterways and land and air in order to protect public health. In fact, everything that we do has a public health and safety motivation. And we also serve as the state's radiation protection agency. We oversee the safety of nuclear sites as well as the use of equipment that contains radioactive materials, as well as overseeing the state's approach to the management of naturally occurring radioactive materials, be they in water, in the ground, in homes due to radon vapor intrusion. And when the mayor first brought this to our attention, we were eager to launch into action and help by evaluating the circumstances that are at issue. Make no mistake that when the Department of Environmental Protection believes that people are at risk, we act, and immediately so. And the mayor, as he noted, launched immediately before we did in order to commence this investigation. And so throughout the process of this investigation, environmental engineers and scientists at the DEP worked with the external consultants to make sure that their sampling strategy was sound, that we were evaluating all the necessary points in order to come to a conclusion that was based on a thorough investigation of both radiological issues and of broader environmental issues writ large. In part because we want to help this community feel safe. I mean, I'm a parent. I would be concerned were there issues of radioactivity even alleged, even if not yet verified. I'd be concerned. And that's the view, the lens that we apply to this work. Because it's our job to protect the public health and safety and the environment. And so we verified the sampling plans and measures that the consultancy hired by the township put forward. We worked with them on refining that. And then as the data became available, our scientists at the DEP worked to understand and verify that data. And it's our conclusion at the Department of Environmental Protection that the radiological status of this building and the grounds of this high school are consistent with typical background levels of radiation that are found in New Jersey, and in fact is at the lower end of those background levels of radioactive materials. And what I think is important for any layperson to understand is that there is always some degree of radioactivity around us. Could be emanating from the materials used to make this table I am sitting at right now. The question for us always is there some product or some component, some base material that was used, whether in the construction of a building or of some equipment, that has unacceptably high levels of radiation? And we look at beta, gamma, and alpha. And in this case, based on all of the sampling that was done and the reports provided in the press materials and that are available to the public will show the breadth and the scope of that evaluation, all of those results are consistent with typical background levels throughout the state of New Jersey. And then in addition, to gain an understanding of potential radiation, not just emanating from building materials or turf on a field, but what might be present in air. Because we know in certain parts of the state of New Jersey, there are greater degrees of radon, which is a gaseous form of radioactive material. We know that there are higher incidents in some areas. Now, this is not considered a level 1 community for radon risk, but nonetheless, a very broad and extensive evaluation of the air quality from a radon perspective was done inside this building. And every one of those results is consistent with what we see across the county, and certainly does not exceed the standard that applies based on guidance from the federal government and the state government. But we wanted to go one step beyond that, in part because we understand that the community is concerned, and we want to make sure that we're not missing something. And so we did an evaluation of additional environmental factors within a 1 mile radius of this high school. We looked at geological data, for example, deposits of other radioactive material in the naturally occurring geology of the area. We looked at what we call the known contaminated sites, be it a gas station that maybe once leaked or a former manufacturing facility, to make sure that were there any known contaminated sites within the vicinity that measures were in place to have controlled for and what we call eliminate a pathway to human exposure. We also looked at the history of land use of this very area to evaluate in part what the mayor had mentioned earlier, as to whether there was concern for fill material that could have been containing some radioactive or other types of hazardous material. And we looked at hazardous material even though the issue here of primary brain tumors is largely associated with radioactive exposure, and not with hazardous substances, but we looked at that anyway. Because you know what? I'm a parent, and I'd want to make sure that we looked at everything. And that evaluation of additional environmental criteria did not suggest that there was a point of exposure over which we should have concern. And for all of those reasons, all three of those reasons, the radiological status investigation, the radon investigation, and the additional environmental diligence, from the perspective of the Department of Environmental Protection, we do not believe that there is cause for any further testing, and that the children of this school, the faculty of this school, and the parents and caregivers of these children and the people in and around this community, they can have confidence. They can have confidence that this is a safe place.
Thank you, Commissioner. The State Department of Health was also consulted regarding this matter and performed their own analysis of this issue and issued 2 reports. The first confirmed the 1997 analysis done by the New Jersey Department of Environmental Protection that a rock found in the classroom that year was not harmful at all. The second report presented findings on the expected number of brain tumors and cancers relative to this issue. Governor Murphy thinks she does not need an introduction, but I have to tell you that this person was an amazing presence for more than 2 years in the state of New Jersey, leading this state through an awful pandemic. And her calm demeanor and her leadership and her knowledge of the situation was absolutely fantastic. And I watched her on TV a lot of times, and I just met her in person a little bit a few minutes ago. And I'm so proud that she's here today to help us out. Ladies and gentlemen, Dr. Judith Persicilli, the Commissioner of the State Department of Health.
Thank you so much, Mayor, and for those kind words. I'm joined today by Dr. Kate McGreevy, who is our Program Manager for Environmental and Occupational Health Surveillance. So the Department of Health is pleased to be here today with you, Mayor, and with Commissioner LaTourette to share the results of the radiological survey and other analysis that the Department of Health has conducted. The State Department of Health supports the actions taken by Mayor McCormick and the township at Colonial High School in conjunction with the Department of Environmental Protection, which have determined that no radiological hazard were identified that warrants further investigation. These findings and the analysis I will explain in a moment represent good news that we hope will reassure current and former Colonial High School students. Over the past few months, the Health Department has taken several steps to analyze the situation and to help the township address concerns raised by the residents and other individuals who attended or worked at the Colonia High School. As of today, the department has released 2 reports about the analysis we conducted. The first report, as noted by the mayor, reviewed the data on the radioactive rock found in the school in 1997. At the request of the mayor, the department, with the assistance from the Federal Agency for Toxic Substances and Disease Registry, subject matter experts, assessed the report of radiological data that was conducted back in 1997. Our analysis determined that no harmful health impacts are expected from the external exposure to ionizing radiation from the rock found in that classroom. I want to just pause a moment and speak about that term expected. It is not a term that we are using in any other sense but a statistical manner. No one expects certain exposures or expects certain cancer. When we use the term expected, it is a statistical term. The second report provides the expected number of primary, malignant, and non-malignant brain and other central nervous system tumors that would be expected among students, staff, and teachers at Colonia High School who attended or worked there between the years 1968 through 2021. The expected numbers were calculated using rates from the New Jersey State Cancer Registry. The number of expected primary brain and other central nervous system tumors among students over the 1968 to 2021 time period was calculated to be in the range from 98 to 105. So from 1968 to 2021, the expected range, 98 to 105. Depending on the registry years used in the analysis, the expected number of these same tumors among teachers and staff over their lifetime was estimated to range from 13 to 14. The department understands that some people may still have questions or concerns, as this is a complex issue, and these reports are very technical in nature. The complexity of brain tumor classification is a perfect example of this complexity. The primary brain and other central nervous system tumors include over 100 histologically distinct types of primary central nervous system tumors. That means the tumor or the tissue under a microscope. There are 100 histologically distinct types. Tumors that start in the brain are called primary brain tumors, while tumors that start elsewhere in the body and spread to the brain are metastatic brain tumors. So if someone is diagnosed with, for example, lung cancer and told that it has metastasized to the brain, that individual would not be classified as a primary brain tumor. We expect many of the questions residents may have going forward will likely be extremely specific and unique to their individual circumstance. The department is committed to addressing each and every individual concern, from former and current residents and students, and we will discuss information in these reports in small groups. We will discuss them with each individual one-on-one. We will schedule calls and meetings and make our subject matter experts available until that last question is answered. If you would like to schedule an appointment with the department's Environmental and Occupational Health Surveillance Program to address any remaining questions you may have, please call 609-826-4984. If you have already reached out to us, and several individuals already have, please know that we will be in touch with you to schedule a time to discuss your individual and unique concerns. Extensive information about brain tumors is also available on our website at nj.gov/health. I encourage current and former residents and staff of Colonia High School to review this helpful information and to, again, contact the department with any questions you may have. In addition, the Health Department also maintains the New Jersey State Cancer Registry on our website. The registry, which is mandated by state law, collects all data on all cancer cases that have been diagnosed and/or treated in the state since October 1st of 1978. All hospitals, physicians, ambulatory care facilities, radiation treatment facilities, and laboratories are required to report newly diagnosed cancer cases electronically to the registry within 6 months of the first contact with the patient. By law, the registry only receives reports from cancer care providers on confirmed cases. Residents who have been diagnosed with cancer can visit the registry and complete a form to request their summary information about their unique circumstance, their diagnosis. This process, which is available to all New Jersey residents diagnosed with cancer, can help to verify that their cancer information was reported to the State Department of Health. If the state cancer registry does not have a record of an individual's cancer diagnosis, please contact your treating physician so that your physician can enter that information into the registry. Our reports, again, can be found on the Health Department website at nj.gov/health. Ensuring the continued protection of public health is a core principle of the New Jersey Department of Health, and our support for members of this community will continue. So for today, I want to emphasize that we know many of you have lingering questions. I encourage you to reach out to us at 609-826-4984 or message us on this website, eohsp@doh.nj.gov. That's eohsp@doh.nj.gov. Thank you for your time. Thank you for your concerns. And again, I encourage you, please reach out to us, 609-826-4984. Thank you.
Thank you, Commissioner. Before taking questions, I would like to personally thank all of the Woodbridge Township employees who have worked very hard on this issue for the last 60 days, including our Health Director, Dennis Green, Deputy Director Phil Bajowski, Business Administrator Vita Samaluka, Chief of Staff Carolyn Ehrlich, Township Clerk John Mitch, and especially our Communications Director John Haggerty and his assistant Megan Kushpa, who have worked tirelessly coordinating the dozens of interviews and conversations that we have had over the last 2 months and will likely continue to have over the next several days. And on a personal note, I want to thank Commissioner LaTourette and Commissioner Persichilli. It is amazing that these two have taken this under their wing, this issue under their wing, and dealt with it personally. It is hard, having been in state government, it is hard to get that level of attention on any issue. And we have had multiple calls and multiple Zooms with both commissioners on the phone, talking to us, talking to Dr. Massimino, and talking to each other. And I just can't tell you how thankful Dr. Joe and I and our Board of Education members and Township Council members are for the attention that you have shown to Woodbridge Township, and we really greatly appreciate that, so thank you both. That concludes our presentation. We will now take questions from the media. When called on, please indicate who you're directing your questions to, and if we can, we'll start on the far left. If nothing, we'll move to the next one. Go ahead.
Yes, I have a question. Hi, Commissioner. How are you? Question for each of you. Commissioner Persichilli, the state just opened a database to start collecting information about cancer cases here, separate and apart from the state registry, specific to this region that just opened. How can the state confidently say that no further testing is needed without gathering all of that data? And then, question for you, Commissioner LaTourette. Certainly, radon testing is important, but it is not the only testing. Has any ground sampling been done? Any subsurface air sampling been done? Any water sampling been done in this building? And again, how can you, without all the necessary information about the instance of these cases, conclude that no further testing is necessary?
Sure. Thanks for that question. Without an identified environmental exposure pathway, there's not more that the Department of Health would be focusing on. You need to find that pathway to continue studying. I'll let Dr. McGreevy talk even more about that. This is her area of expertise.
Right, so I wasn't sure. Could you please clarify? It sounded like you thought that we were gathering information, and I just wanted to make sure that that's what you were asking.
That is what I'm asking. In fact, something I meant to include in my question is that typically out of a sampling of 100,000 people, 3 to 5 would have a malignant brain tumor. And yes, we did see reports that the state was going to open up a database to collect specifics to this case. Is that not accurate information?
That is not accurate information. We have
There's no intention of gathering data specific to this region?
So we have a state cancer registry that, for what we did and what we released today, was we utilized the state cancer registry to apply the statewide rates of primary benign and malignant brain and other central nervous system tumors to this population of the school for both students and teachers. And we calculate what we call, in statistical terms, an expected number. And so we did that to provide a context for the community, the number of these types of tumors that we would see if the school experienced rates similar to the state. So I'm not sure about the information that you're asking about. We're not collecting information. I believe that we were saying if somebody wanted to confirm that their cancer was in the registry, they should visit our website, and there's a process for them to do that.
And so, how many years, for the numbers that you have, for this formula that you use, how many years are you comparing against the New Jersey State Registry?
So we're not comparing it against the New Jersey State Registry. So the first step that we do when people raise cancer concerns to us is to try to identify what would be expected in terms of the rates that we know from the state. So we took the state's rates, and using these specific formulas, like in the report, we did it differently for students than for teachers and staff. We calculate what would be expected among this population based on the state's rates. So
Sure. So the first thing that I think is important to understand is the way that an environmental investigation works, right? You're looking for something, right? And that something you're looking for is based off the reason for your concern. In this case, illness that is most correlated to exposure to radiation. And so our investigation began there with respect to sources of radiation. And that investigation of sources of radiation was very, very thorough. And it identified nothing that would give us concern such that additional testing would even be necessary. So in the course of an environmental investigation, that's the goal. The goal is to identify the presence of a problematic source material. And then if that problematic source material is identified, you delineate the sort of nature and extent of it. In this instance, there's nothing to delineate because there's not a problematic source material. And that's the way an environmental investigation works. Now, because we wanted to make sure we were going a step, several steps in fact, beyond that, we then evaluated multiple other conditions to see if there was a source issue that we should be attuned to. And there wasn't. And so again, there's nothing to delineate. Now, of course, if there were some new information to materialize, we would investigate it further, but there is no, at this point, there's no reason to. And to do so would send, I think, the wrong message to a community that is concerned that there is an adverse circumstance occurring that we see no evidence of whatsoever. And so that's why we arrive at this point. You ordinarily wouldn't test soil to identify a radioactive material, particularly when the initial investigation didn't suggest that was necessary. And it's on you, it would be, how do I say this? We wouldn't expect to find radioactivity in water in an area like this. That may be the case in places that are drawing their drinking water from the ground in known in formations known to have radioactive concern. But we also, number one, the water here doesn't come from that kind of a source, but also we looked at the geology of the area, and again, no concern. But I understand the parents and certainly those who have suffered illnesses. I understand the inclination to chase down whatever it could be. We have confidence in the examination that was done here.
Any other questions? Yeah.
This is for Dr. Green. Now, you're looking at between 98 and 105 people between 1968 and last year. Is that a concern for you, just looking at the overall those numbers?
So we provide,
I'm sorry to interrupt, but again, you're looking at the concentration of this school.
so those numbers are what we calculated that we would expect to see in this population based on statewide rates. Malignant and non-malignant brain tumors are actually quite common, unfortunately, in New Jersey, and the rates are actually consistent in New Jersey with United States. So this approach of calculating the expected number was done to provide context to the community, provide information to the community about what we would expect to see among this, what we call cohort, among this population, if the background rates were applied to them. And so that's just a piece of information to put into context.
So there's nothing alarming, is what you're saying?
That is a calculated number that's based on state rates.
Okay, but there's nothing alarming, is what you're saying?
Right, yes.
Yes, David. Yes, Brian, sorry.
I'm not sure if this is for you or the commissioner, but when I glanced through the T&M report, is it crystal clear that there was not a single instance of excessive radiation found either by the radiation detectors or by the radon detectors in any of the instrument calculations? That's what I wanted to clarify.
Yeah, so I understand the question, Brian, thank you. So the way to think about the radiological investigation, we compare, it's statistical in nature, not too dissimilar from what Commissioner Persicelli was explaining. And so what the point of comparison is not to some promulgated regulatory standard, right? This isn't like lead in drinking water, for example, where there is a number you don't want to be above. There is a range of background experience throughout the state that does not pose a concern from an environmental health exposure perspective. And the levels found here are on the low end of that range, consistent with what you would expect to find as the remnants of ordinary decay, it's called.
And nothing was exceeding that range.
No, if it was, then the means and averages, no.
Yes, sir.
I can try to address that. So I think the sort of initial silence you might get from professionals in our spaces to that question, the reason for that is not because we doubt ourselves, but because everything in life carries a measure of risk. And it would be impossible and inappropriate for us to somehow rule out any potentiality whatsoever that there could be a connection to something once upon a piece of land at some point in time and someone's later illness. But when we look at the points that are appropriate to evaluate from an environmental perspective, we don't see why there would be cause for an exposure concern here in the way that there has been. And I think what can be surprising to folks, especially when they hear stories in the way this one has been portrayed in some spaces, I think what can surprise folks is that the incidence of these illnesses is higher than we might readily acknowledge. And especially so when you collect that over time. And that has been the experience of my career, when folks come to recognize that it can be surprising, but it's not significant in the way that we would consider it concerning.
I think it's important to note that the majority of risk in developing brain and CNS, central nervous system tumors, really remains unknown. The only established risk factors are family history, there's some genetic factors, and exposure to high rates of ionizing radiation. There's a lot of different studies out there of all different types of elements, but none have been scientifically confirmed. So, like Commissioner LaTourette says, the numbers sometimes seem very staggering, and yet they're expected rates. And if there's a silver lining at all in the expected rates, the majority of them are malignant or non-malignant. The majority are non-malignant. I think it's close to 70% are non-malignant, but there are 30% malignant.
Any other questions? Yes, sir.
This is for Sean or anybody, but so I guess obviously it's safe to say that no one believes that this is a cancer cluster, because that's how it has been reported and portrayed in a lot of different spaces. And I guess I'm asking, like, a school of comparable size would have these same rates of primary brain tumors that we found here in Colonia. Is that basically what the data is showing?
I think it was wrong of whoever started calling this a cancer cluster to use that phrase. It was ill-informed.
One more question. Mayor, I believe you said it's unlikely that contaminated fill was brought over to the school. Again, the question about testing the soil, even though it's unlikely, there was no thought to continue the testing of the soil?
Again, I'll leave that to Commissioner LaTourette.
There's nothing that suggests to us that that would be a necessary step. And had I thought it, I would have had folks here already.
Sir?
Just to follow up, so I guess what I'm asking again is, the numbers seem staggering when people saw them for the first time and heard about them at Colonia High School. I think it's up to 122 people who either attended the school or graduated from here and worked here, have a primary brain tumor, and then 75 additional cases of rare forms of cancer. Now, we're saying based on everything that what the data is showing is that a school of comparable size in New Jersey would have similar rates to, between 105 and 98. So this is not an outlier. This is what the number of primary brain tumors you guys have done is not unusual for a school of comparable size in New Jersey. Is that correct?
Yes, so any large population, any cohort of this size, if you apply the rates of what we observe to that population, it actually really puts that into context. But we encourage people to come to our website. Our cancer registry team has a lot of publicly available data, a lot of information, which really educates the public about how common cancers are. We have some new information that they put together. They call it a data brief, and it really puts that in perspective in a general sense. This report that we released today is really putting it in the context of just this population, so we could provide the community with that perspective. But unfortunately, cancer is, very common. So yes, you're right.
I think it's also important to note that the list has not been verified or validated, and it's not scientific. It's just basically a list that came from social media. And I respect Al Lupiano and the job he did putting this together and bringing this to our attention and making us investigate this. That was terrific. But the list is not in any way official, and nobody has seen the list except him. I saw a list redacted with names a little while ago, but it's not a validated or verified list in any way. And I know at least in a couple of cases, there's people on the list, from what I know, that maybe shouldn't be on. For example, somebody's on the list that went to school here for 1 year, not 4 years. So that doesn't have the same weight as somebody who went here for 4 years. So keep in mind, when looking at all these numbers, that this list is not at all official, and it's not been verified scientifically, it's not been verified medically. It's right now just a list with some numbers of the research that has been done through social media.
But in fact, there has been a request to the state to take on doing that data gathering, and the state has no intention of doing that, correct?
So in the work that we do, we rely on our partners at DEP and sometimes the US EPA, who will work with DEP when there's environmental contamination. We'll do surveillance for health outcomes, which could be cancer, it could be other health outcomes, depending on the environmental contamination. And we work with CDC, the Agency for Toxic Substance Disease Registry, to evaluate the potential for health effects. But in order to do a study, I think what you're referring to, we need a delineated area where people are exposed. We need an exposure to characterize. We react to the environmental data, if that answers your question.
If your intent is to calm the community down and say that there's a problem, why don't you just test the water and soil? Because there is no reason to. I think that there was a several $100,000 investment for that very purpose, right? To evaluate what could be a related environmental exposure. Unless you wouldn't test soil for this or water for this. I understand the inclination to think that, I do. But what you would test under these circumstances has been tested for.
Well, the water comes from Middlesex Water Company, which is a separate entity. They do not use groundwater here for anything. So the water's not an issue. Middlesex Water Company water is tested daily, hourly. That is not an issue. The water is simply not an issue.
So the first thing that you would do in this particular circumstance would be to evaluate whether you're seeing signs of radiological activity that are of concern, that you then might do further ground penetrative work. But there's no reason to do that here. There's no reason to do that here. And I think that the wise investment has been made. But I can understand why, especially for folks suffering from an illness, that answer might not feel like enough. I started my career representing victims of toxic exposure who were exposed to horrible things in their water. I cannot underscore how seriously we take this. I'm sorry, I couldn't make out your question. What I think, based on my experience in the space that is related to environmental exposures, it doesn't appear to me as though there has been an environmental exposure of consequence here. And I think I think your question is grounded in what my colleagues from DOH were talking about a moment ago, about how the incidence of cancer is higher than we may appreciate.
Yes. Yes. This is a Colonia High School press conference. You know the venue you need to go through to get those questions answered. Thank you.
And we would never, ever, from the Department of Environmental Protection, approve any kind of development or issue permits that would cause concern to public health. Our whole job is to protect the public health and the environment. Thank you very much, everybody.
Thank you.